Welcome to our YouTube channel. In this video we are going to talk about best home remedies for swollen feet, edema remedy. So before starting this video, like this video, and subscribe to our YouTube channel for future updates. Swollen feet can be caused by a variety of conditions. Some reasons such as mild injuries are obvious and treatable. Others on the other hand could indicate a serious underlying health problem that necessitates immediate medical attention. We'll look at some of the reasons why a person's feet may appear swollen, when they should see a doctor, and what treatment options are available. Number 1. Edema. Edema is a type of swelling caused by trapped fluid. Swelling that happens when fluid becomes trapped in the body's tissues is known as edema. It mostly affects the legs and feet, but it can also affect other parts of the body like the face and abdomen. Other edema symptoms include: over the damaged area there is a gleaming, stretched skin. Skin that remains dimpled after being pressed, pain and a loss of mobility. If the lungs are affected, coughing or trouble breathing may occur. Treatment. Edema may resolve on its own, or there may be an underlying problem that necessitates medical attention. Wearing support stockings, decreasing salt intake, and lying down with the legs raised above the chest are some of the home cures. If the swelling persists, a person should consult a doctor to rule out any underlying causes. Number 2. Foot or ankle injury. Swelling in the foot or ankle can be caused by trauma to this area of the body. A sprained ankle, for example, might cause the foot to expand due to overstretching of the ligaments. Treatment. When treating a foot or ankle injury, it's best to elevate the foot as much as possible and avoid putting weight on the affected leg. Swelling can be reduced with the use of an ice pack or compression bandage, and pain can be relieved with over-the-counter pain medicines. If the swelling and pain persist, a person should consult a doctor to rule out more serious harm. Number 3. Pregnancy. Swollen feet and ankles are a frequent sign of late pregnancy. Fluid retention and increased pressure on the veins cause this edema. Remedy at home. Women should elevate their feet. Whenever feasible, use comfortable and supportive footwear, and avoid standing for long periods of time to address swollen feet during pregnancy. Fluid retention can be reduced by staying cool, limiting salt and increasing water consumption. Supportive apparel such as tights or compression stockings can also help relieve discomfort and minimize swelling. Number 4. Pre-eclampsia. If swelling occurs quickly and is significant during pregnancy, it could be an indication of pre-eclampsia. This is a disorder that can develop during pregnancy or shortly after delivery. Protein in the urine, quick excessive fluid retention, and elevated blood pressure are all symptoms. This is a serious condition that usually develops in the second part of pregnancy, and can lead to eclampsia, which is even more hazardous and requires immediate medical attention. The following are symptoms of pre-eclampsia: a lot of swelling, headaches, dizziness, vomiting and nausea, changes in vision. Urination is less frequent. Treatment. If a pregnant woman develops any of these symptoms, she should immediately contact her doctor or midwife. Number 5. Lifestyle factors. Swollen feet might also be caused by certain lifestyle factors. These elements include: residing in a sedentary state, being excessively fat, wearing shoes that don't fit. Remedy at home. Swollen feet can be avoided by exercising regularly and maintaining a healthy weight. Other options for treating swollen feet include: consuming lots of water, compression socks or stockings should be used. Soaking the feet in cool water is a great way to relax. Raise your feet above your heart on a regular basis. Maintaining an active lifestyle. If you're overweight, you'll want to lose weight. Maintaining a healthy diet and limiting salt intake. Massage your feet, consuming more potassium-rich meals which can aid in the reduction of water retention. Number 6. A side effect of medication. Steroids have the potential to induce edema in the feet. Certain drugs, especially those that promote water retention, can cause edema in the feet. Medications that can induce swelling in the foot include: estrogen and testosterone are two examples of hormones. Calcium channel blockers, which aid in blood pressure management. Androgenic and anabolic steroids, as well as corticosteroids, antidepressants, NSAIDs, and non-steroidal anti-inflammatory medications that are used to treat inflammation. Medicine to aid in the management of diabetes. Anyone who believes their prescription is causing their feet to swell should consult their doctor, who may be able to adjust the dosage or prescribe a new medication. Number 7. Alcohol. Alcohol causes the body to retain too much water, causing swollen feet. If the swelling persists for more than 2 days, a person should seek medical attention. Recurrent swelling of the feet, after consuming alcohol, could be a sign of a heart, liver, or kidney problem. Remedy at home. Swelling can be reduced by elevating the feet above the heart, drinking plenty of water, on minimizing salt intake. Symptoms might also be relieved by soaking the feet in cold water. Number 8. Hot weather. The feet might swell in hot temperatures because their veins stretch to cool the body. Fluid may seep into the surrounding tissue as a result of this process. Fluid can build up in the ankles and feet as well. Remedy at home. In hot weather, drinking enough water and wearing well-fitting, comfortable shoes with some airflow might help keep your feet from swelling. Number 9. Infection. Swelling of the feet and ankles can be caused by an infection. People with diabetes are more likely to get infections in their feet, so they should be aware of any changes in this area of the body, such as blisters and ulcers. Treatment. Antibiotics are commonly prescribed by doctors to treat infections. Number 10. Venous insufficiency. When a person's blood doesn't flow adequately around the body, it's called venous insufficiency. This is due to leaking blood down the veins and fluid retention in the lower legs, notably around the feet and ankles, caused by broken valves. The following are symptoms of venous insufficiency: legs that hurt, changes in the skin, such as flaking. Varicose veins are forming in new places. Ulceration on the skin, infection. Treatment. Anyone who is having symptoms of venous insufficiency should see the doctor as soon as possible. A doctor may recommend lifestyle adjustments to address venous insufficiency, such as exercise to assist maintain the blood circulating around the body efficiently. Compression stockings and anti-clotting medicines can also assist. A doctor may recommend surgery to try to repair the damaged valves in some circumstances. Number 11. Blood clot. Blood clots form when blood does not flow properly across the body, causing platelets to stay together. If blood clots form in the leg veins, the blood may be unable to return to the heart. The ankles and feet may enlarge as a result of this. Blood clots grow deep in the legs, causing deep vein thrombosis, DVT. DVT is a dangerous disorder in which the major leg veins get clogged. The clots may break free and travel to the heart or lungs in some circumstances. DVT symptoms include: 1 leg is swollen, if you have leg pain or discomfort. Fever of low intensity, the color of the leg changes. Treatment. If a person sees any symptoms of DVT, they should seek medical help right once. To treat blood clots, a doctor may prescribe blood-thinning medicine. Wearing tights, compression stockings, or loose-fitting garments around the ankles can help avoid blood clots. Staying active and decreasing salt intake are 2 other ways to prevent heart disease. It's also preferable to avoid standing or sitting stationary for long periods of time, especially with crossed legs. Number 12. Lymphedema. The goal of lymphedema treatment is to drain the extra fluid. The lymphatic system aids in the removal of undesirable elements such as germs and poisons from the body. Lymphedema is a condition in which lymphatic fluid collects in the tissues due to abnormalities with the lymph vessels. Lymphatic fluid can build up if lymph veins are injured or non-existent, causing infection, poor wound healing, and even deformity. Lymphedema is more likely in people who have had radiation therapy or lymph node excision. Anyone who has had cancer treatment and is experiencing swelling should see a doctor very far away. Lymphedema symptoms include, in addition to swelling of the feet, infections that reoccur, motion impairment, aching, a sense of heaviness or constriction, a thickening of the epidermis. Treatment. Exercises and focused massage are 2 treatments for lymphedema that might help drain the excess fluid. It may also be advantageous to wear bandages or compression clothing. Number 13. Heart disease. Heart disease or heart failure can cause swelling in the feet. If the heart is injured, it is unable to efficiently pump blood to the heart. Swollen feet can be caused by right-sided heart failure, which causes the body to accumulate salt and water. Symptoms of heart failure include swelling of the legs, ankles and feet, as well as a feeling of being out of breath, especially after exercising or resting down. A fast heartbeat, weakness, fatigue, if you're coughing or wheezing, blood-tinged phlegm, white or pink, stomach bloating, fluid retention causes fast weight gain. A lack of appetite, vomiting or nausea. If you're having trouble concentrating or if you're confused. Treatment. If a person has any of the symptoms listed above, they should seek medical help right once. Medication, medical devices to support the heart, and surgery are all options for treating heart failure. What do you think about this video? Do let us know down in the comment section below. If you enjoyed this video and want to hear from us again, be sure to hit that subscribe button before you go.